Can you discuss at least three kinds of STDs?
Three examples of STDs. Number one, very common, is AIDS, yung acquired immune deficiency virus. So, for one thing, it's a virus, at present, still untreatable but manageable. Life expectancy nowadays is far longer than it was when it first got discovered in the early 80s. It's a type of virus that gets spread through sexual contact. It is mostly common among the gay community because of the manner by which homosexuals practice sex. They're quite usually gay people are highly active sexually, so that is how it spreads. Kasi among heterosexuals, yung heterosexuals, that's between male and females, they're usually quite loyal to their partners. Pero usually sa gays, marami silang multiple partners, kaya usually ang spread sa gays are higher than in heterosexual sex. So yun, it gets spread through sex, and it takes quite some time before you eventually discover yung signs and symptoms. It sometimes would appear as a skin rash. Yan yung Kaposi's sarcoma, which is a complication of AIDS. It can appear as an untreatable form of tuberculosis, or it can appear as a form of pneumonia na untreatable as well. Kasi the reason why most of these illnesses na nakukos ng AIDS is untreatable is because yung immunity ng isang tao gets destroyed by the virus. So yun yung work ng virus kasi. Once it gets into your blood, into your system, it tries its best to kill the natural immunity strength ng tao that has the illness. So even if the person is big or strong initially, his immunity eventually dies, or it eventually gets weak to the point that it can no longer fight off infections or cases of cancer sometimes. So that's how they usually end up dying. So at the moment, it is a very great concern for us here in the Philippines, because the Philippines is one of the countries in the world wherein the spread of the disease is very high. Every day, I think the Department of Health has come out with a certain number of people getting who eventually end up with AIDS nowadays here in the Philippines. Kaya nga, they have an ongoing campaign of practicing safe sex, distributing mga condoms. Kasi in a way, by giving out condoms and practicing safe sex, you lessen the chances of contracting the disease. So AIDS is one. Another form of sexually transmitted disease would be gonorrhea. It's caused by Neisseria gonorrhea. Now, it is a form of bacteria that is spread also through sexual contact. Usually, persons who are infected with this disease, both male and female, would normally exhibit signs and symptoms of painful or burning urination in their penis or in the vagina when they urinate. And the very common symptom that you would see in patients with gonorrhea is yung discharge. Usually they're the ones that come to the doctor and complain of a yellow greenish material that comes out of the opening of their sexual organs. Now, this kind of illness is treatable. Usually we just take antibiotics that doctors would prescribe, and oftentimes in less than a week the patient is able to recover. But it is strongly advised that while you have the disease and still undergoing treatment, you have to wait at least 7 days before engaging in sexual contact again, in order to prevent spread of the disease. The third example of a sexually transmitted disease would be chlamydia. Chlamydia is caused by Chlamydia trachomatis. It's another infection, just like gonorrhea. There's not much of a discharge in chlamydia, but patients would often complain of painful sex. They would often complain of painful urination. This kind of illness is not very serious, but if untreated, eventually it might cause complications in the patients, especially for women. For women with chlamydia who don't get treatment, usually it affects the normal route of the fertilized egg from the ovary going into the uterus. So usually the egg, because of the infection caused by chlamydia, when it passes through the fallopian tube, it would cause blockage of the passage of the fertilized egg, and so you would develop ectopic pregnancies, which can be fatal for women who would have ruptures of ectopic pregnancy. But generally, it's not really fatal for both men and women as long as they get treatment. Treatment is usually given with antibiotics also. So, unlike AIDS, the other two that I mentioned are treatable. AIDS is treatable nowadays, but treatable in a sense that you're only able to control the progression of the illness. We are able to stymie its progression. So patients with AIDS, they tend to live longer lives nowadays, and before they end up with the complications that ultimately cause their demise.
Thank you.
So, how can we avoid STDs and what are the treatments we can do?
Okay, the number one way in order to avoid STDs is very simple: abstinence. Abstinence means no sex at all. Okay, because from the illness itself, STD, it's sexually transmitted disease. So it's a disease that you transmit through sexual means, diba? Sexually. So if you practice abstinence, then there's no transfer of the illness, even if one partner is infected. So another way of preventing or contracting STD would be to practice safe sex. Safe sex entails, number one, responsibility by the people involved in engaging in sex. One should be responsible for oneself to make sure that you are okay, you're not sick with anything, you don't have anything that you may potentially spread to your partner. So you have to know that before you engage in sex. Another thing is by using things like condoms. Kasi condoms can help secure usually it is transferred because of the discharge of one person going to the other. So if you use a condom, you're able to protect yourself from contracting the illness. So basically, that's the way how to prevent STDs from happening. Now, treatment, there's so many forms of treatment, but oftentimes the treatment is really just through medication. Medication can be given intravenously, so that would mean you would be put they put intravenous line in your veins, and then they introduce the drugs that will help kill the infection. They can give medication through intramuscular injection, so you get injections directly into your muscles. And number 3, by taking oral medications. So those are the means by which you treat STDs. Now, treatment is varied. First, the very important thing is to first get a complete diagnosis. You cannot treat STD by yourself by just taking your own medication, going to the drugstore, buying the medication yourself. Because for one thing, you have to be sure exactly what kind of STD you have. Not all antibiotics will work for all STDs. There are certain antibiotics that are effective for a particular STD. So the doctor has to be able to make the diagnosis first as to what kind of STD you have, so the doctor can come up with a specific treatment in order to kill the bacteria or to help with the virus. So you cannot just treat it through shotgun method. But basically, treatment is through medications alone.
Thank you po.
You're welcome.